Hello everyone, so today we are doing chapter 19 of kidney tract disorders of illustrated textbook of pediatrics, features of kidney and urinary tract disorders in children, many structural abnormalities in kidneys and urinary tract identified on DNA and science training, urinary tract infection, anxiety, ureter, proximity, etc. have potential to damage the growing kidney. Products usually steroid synthetic normally rarely leads to chronic kidney disease, chronic kidney disorder may affect protein bulking, sustained kidney function, kidney abnormality functions, switching water soluble salts and ions from the blood by not filtering out. Large molecules and the absorption of necessity filters small molecules such as glucose, amino acid, dilution of concentration of urine to optimize fluid balance, regulation blood pressure to the volume of vitamin D, the regulation of acid-base balance, the sustainable function encapsulates a range of variables including plasma protein and anemia, serum electrolytes, blood pressure, urine concentration, electrolyte and urine output, insulin, plasma protein and product and muscle breakdown is only used to sense and monitor renal function. However, the normal ranges in creatinine increases cell china, often increasing muscle mass and height. Protein levels does not become abnormally high until the infection is not reduced. Urea increase makes it kidney insulin, chronic kidney disease, and increases the fertilizing creatinine. Now, it is more specific as the it's also rises in dehydration, catabolic state, high protein diet, and GI bleed. High urea levels when phosphorus are empty. The basis of GFR is a more appropriate monitoring function that is a formula used for everyone in the right. In centimeter and creatinine might be more. Because the formula concentration rate is lower than the one from especially in GFR at 28 weeks is 10% of the combination. Intermention correctly GFR going to the protein but on the 17 meters squared sapling rises and velocity is a place when the drought of 80 per minute. Here the drought for the video for the 19 minutes per 1.7 meters squared street. Common zero GFR alignment is a form measuring feelings of a substance. Basically, for example, giving CMOS for example, use in the most values in the three that we want. Once I use in the system in the one, followed by C that test. Two manual experience formally, usually from a not to be used in therapy, chemotherapy, and research, during the 3 months of this before the pregnancy of disease, during osmolysis and look at how and the best can constitute the infants how well they are. Radiological investigation of vasculosis because the name is not policy and functional abnormalities, now 7% anomalies, since reduction by the time to substitute more significant structure research anomalies kidneys in the tract. On the flight internationally and managed prospectively, normalities and 1,000 birth, they are potentially enhancement because the may be associated normal linear development of functioning CKD predisposed to genital infection, also substance requires surgical treatment, be associated with non-renal resulting anomalies, undelivery rejection, early secondary tract anomalies provide experiencing to minimize progressive neural damage, however, minor abnormalities also the most common mild related polyclarification which does not require intervention but really investigation is suitable and unwarranted clearance. The enormous delivery of infusion ultrasound screening, accessible kidneys, renal resources, as any other frozen unit life from fetal urine, there is several illegal hygienic results in participants. This is related to the lungs, multisystem is possibly results from failure to with diabetes, related peristalsis, and electronics in the system. Reason for using one function such as the spacious system relationship in the connection with the bladder. Halfway have been related. 2 years of pregnancy, mastectomy is indicates only 15 minutes, very large hypertension flares. But this is where MCT which is not assisted specifically, do not produce an bilateral polycythemia cystic. This plastic can be caused by autosomal recessive polycystic kidney or autosomal dominant. Injury system diagnosis in contrast to recessive kidney disease as some normal gene functions maintained with both kidneys are always affected. BDPKD has an incidence of 1 in 1,000. The main symptoms include hypertension and chronic kidney disease requiring renal replacement in late adulthood. This is associated with several extra renal features including system and living and stability in the reason and natural collapse of the kidney or partial kidney. And then the lower portion of these enzymes from the normal coordination of kidneys, the normal positioning in this case simplex kidney drainage. Simplex kidneys can vary from simply combined kidney base in the feed kidney with 2 ureters. These ureters can have an normal drainage with a ureter from the lower whole quantity of reflexes. Whereas the other political nature of property integrated size and monetary hospital level, they can see and gain further certain previous season of the intramural structures, such as visible parametrosa, like city, a case of state of the head dominant analysis, equalization, the last level environment with is replaced by the cystic level later and the place of things and the training syndrome. And sorry, now we will see on these logical investigation to be mainly ultrasound standard and procedure to consider the start. The right pattern is not functioning, except visualizing the side validation shows the method vaccinations. Small vertical fashion personality that one wants to be nominated. Mobile is not just completely dependent on the not that far to stars. Motivating straight to contrasting between budgetary with capital, conditional valuation and acne because the factory is in the flux in the construction. This not using and testing investigation, especially the unintentional high radiation loading to reduce infection. Seriously, and producing electric curiously, identify position of getting stones and driving to account for the children, train and family extreme and first unaccepted finance and mother who's near and family stores that feel as shown with the development. Nuclear medicine being lessons which was diagnosed at the succinate. Spadix and healing topics, effects, functions effects such as scars, but it is non-sexual failure to show that very sensitive, so motivated to 2 months of healing time, touching the one by working on scars. Multi-renal down multiple sedary child vaccine, living food, dynamic scan, osteoporosis, medicine, substance treated from the body, the urine, nail strainers, best is found with the high urine rate, so for some often, which are insulin or not the top priorities for more than 4 degrees, standard nutrition and use while we are intended cystograms, function test, bladder flow, urodynamics. This is how well bladder is something to get rates rather than anti-scan contributing to the current. Simple segment kidneys on track, bilateral imaging, so bilateral metastatic is flat should be able. Kidneys fetal urine, extension of the oligo. Finally, have a presented contextual sleeper from respiration. The product feces, low circular speed nose, a prominent presenter cold and downward sliding to the eyes, and hyperplasia, that's failure, and then deformities. These are the features of the CP product systems. And then normal experience is also featured in on the right. It is replaced by system size, which is to and the ultrasound showing multiple discrete system. The abdominal recessive polycystic There is diffuse quality marking of both between and autosomal dominant persisted in their quality suppresses surveillance between normal and gamma. The kidneys are enlarged in the face, partial kidney. The text kidney showing the diversity of the multi-flaccid behavior, multi and clean belly syndrome. Absent aspiration syndrome, known as mental appearance and condominant. This is a large monotherapy suggestion. This is for the heart instruction. And we have a similar type of structure here, so we will see it. You can see this delineated hydronephrosis, commonly instruction on the left and this sideways structure in the right. The later hydronephrosis will have a neck structure in posterior, immediately north. So, in fact, the structure is towards something validation of the use that proximate this native structure. Person is typically present at A or at the surface range of the disease for the unit type, which one of the blood next one units from that we can that person validation. Especially with that for a list of the strong maturation to lead excision from the checking new type of fixing exception to use for minute upper application or the platinum indicated such as the nose supply, neuropathic bladder, or the procedures and for a deeply concentrated and then especially to the walls, the consequence of exception is here as shown. Afterwards, this preserves in the specificity, which is full function and the basis. News several validated tests for the sequence spreading real spatial class organization should see in intra. These findings are given with blacks in isolation, association with race and genocide and multiple systems that fail particularly interacting carbon tissue solution. Fistula is of facial, aesthesia, engineering, and abnormalities. OCD management, an example of a protocol for infantility and diagnosed anomalies is shown prophylactic and antibiotic really started at birth to try to prevent urinary tract infection on both practice various centers as minimum taken as a low GFR, you can say is low and mild infection may not be evident in the first 2 days of life and the substance. Therefore, be delayed for 3 weeks, however, it is having a post-serial warrant investigations, including an ultrasound investigation to the program and the release of the network investigation issues that was with errors requires the logical intelligence such as stethoscopic ablation. The secretary flexible are the different minimum anti-fragmentation infection. These details are disclosed as an antibiotic pediatric rather than other mental disrupting medicine. These are the closely testimonial within the space of medicine maximally. It is 50% of those results episode gradually after a unit type infection or accompanied by pathology, neuropathic lateral exception. Severity varies significantly. Minor parts of the resolved phase, but we are that is slow enough to cause validation of the later may have significant long-term impact during referring to the bladder from the ureters after worrying results and affected by unreachable crisis. Infection the kidney will become infected by an infectious process rare enough to reach the kidney. Bladder voiding pressure is transported to the lymphatic, which may contribute to the damage if voiding pressure is. Anti-diagnosis of the anomalies start with antibiotics. Dilated hypermetrics and dilated lower unit self made as a sign of the blood avoid the exclude procedures of walls of normal and CG surgeries as well. Normal stop antibiotics to get sound application months at urination in the male and the normal in female at the sound of 46 days is normal. Stop antibiotics to get sound 18 months at normal for the investigation. This is the management of victims with emptinessly diagnosed UTIs. Tracks abnormalities, anomalies, and fusing initiating system related to that. This is procedure case history is Police proceeding with some large volume of electricity was noted on an antenatal ultrasound of the unique suggestion in male fetus. There was progressive electricity causing a growth reducing or increasing volume of any other fluid and fetus scans. After which treatment after surgery and prophylactic antibiotics started. An ultrasound showed bilateral hydroelectricity, small respective basis function, children's histogram showed severe bilateral cyclopetic flux, small token rider in bilateral posterior. Posterior was a confirmed cystoscopy and ambulatory surgery. Surgery. Subsequent provocation requires tracking is described. Bilateral hydroelectricity requires full investigation with treatment system. Neutral was crossed with versatile reflex. The standard rivals articulated walls and validated Australian from Australian walls originating individual sounds from the material and protecting physically related wall. Infection may damage the tissue scars and shrunken only functional segment of the kidney reflects neuropathy. Scarring is bilateral, severe, progressive, chronic, and medicines never coming. So this is scarring is an suspended matter and major indication of clinical intervention. There is increased risk of habitation in childhood. Early adult death is estimated to be up to 10%. You can track infection you guys are 2.7% girls, 1.2% to have at least one symptomatic UTI symptoms of 6 years and 12 to 30% of the recurrence within a year. UTI may involve the kidneys virusitis when it is usually associated with fever and systemic involvement or maybe due to cystitis when there may be no fever. UTI can be important, but up to half of patients have a structure of non-active radiation fat, chronic kidney damage, the growing kidney was having a scar, so the kidney habitation and the community virus by creation. This is Microsoft regulatory and service of broad and determinants in the intelligence to the student in finding effects in years, not in years. This is approximately because of the need to get them in similar to cases, simply to let it come again to the pretty temporary and very nice. Dilated retention and opportunity. Interpretation is shall raise with each. Mental symptoms are not suspect people receive, but not always levels of physical and developed rapidly as infection problems cannot rapidly carry symptoms. As a symbol to see efficacy along with only the conservative present. Seriousness is of the scenario side in emergencies and the serial element is usually side as a nearby in boys of diamidrosin boys. The severe can also be secondary to urinary conditions and considerations that consists of step of the urea and loss of the following sexual includes the most common error in most of the urea, especially because it's failure to establish copy in the first place. The domination urea is not make a picture and prevent renal damage. Maybe mystery where it's also easily overdiagnosed but overzealous interpretation of union toxic results and contamination with exact situation. This is as unnecessary investigation. For sharing every gene can develop combined clean gas sample into waiting clean pot. And then happens to know this is recommending monthly the child and the girls washing which can be level below down with boss soaked in cold water. Something for a quick moving technique and adhesive acid bag applied to the brain after further washing on the maybe contamination from the skin of feces. And you will see catheter if there is urgency in obtaining sample and no urine has been passed. Second, your respiration and using precious remains of the dietary material just about the previous under ultrasound diets may be used as severely and points requiring patient diagnostic what to make use of the daily. In the older children, urine can be obtained and collected in mystery sample. Careful cleaning collections are necessary as contamination with both white cells and bacteria developed from under the post-killing boils and from flexible and vagina and body. I believe within some should be observed and under a microscope 25 grams of cell culture straight away, and this is indicated in all functional children under the age of 6 years. It's suspected that this is not possible. Urine samples should be refrigerated to prevent overgrowth of contaminated bacteria. Usually, white cells are not a liable feature of an UTI, as similarized urine storage may be susceptible. Children without the UTI and children with rhinitis avoidance genitals. Lipsticks can be used as streaming as super which still give from the UTI suspected unless more criticized season outside and negative as is linked to UTI and life. Urine culture should be performed if the clinical symptoms and lipsticks has been correlate in the table. This is the presentation. So, emphasis on anything that has to be like feeding, Walton Road, jaundice, septicemia, face of urine, the various issues for more than 6 months. In children, this year, because emergency with non-clinical line tenderness, fever within the third sizes, exaggerated shriveling, lethargy, and anorexia, wanting diarrhea, hematuria, face of urine, requires seizures, requires of many races. So this is not a good gene catch by the weight of nutrient rough and then this manipulation is also discussed in functional spheres and in the paper side of tracing I tried to figure that this is the chain into the light and first starting to continue to the elements UTI diagnosed with the bunch of blooming culture. You say just also matter. So, understanding the two different physical events we get and into the bedroom, we precisely both negative and she did the technical standing for culture if the conditions suggested blood protein and glucose present on test suggesting useful in environmental in fact it is five side but not to some mediation and without nutrients. A picture culture of more than 10 of 5 cuneiform luminous fuse of single organs and formulator is in a properly collected specimen gives a 90% probability of detection. The same result is found on a single sample of probability rises to 9%. It's not a mixed organisms usually represent contamination occur is a tile that was collected any bacteria growth of a single organs of formulator in Dexter sample superficially as possible. Diagnostic of infection. When the condition is supposed to be tested in all reference to the understanding of the yes, the freedom groups that they sought to discuss infection infecting advances is as a result of that flora and symptoms in track by basic or the hematogenous in the newborn and the most common organism is E. coli following Uppsala produce dominant and therapeutic specialist producing more commonly dominant non-familial specifically positive presence and of effective and produce infection predisposed to chronic population with the pneumonia and localized bleeding. Pseudomonas infection indicates the presence of some structural normalization in the drainage and it is also more common with plastic catheterism in the post-sector resistance infections increase into the food diagnosis UTI, immune traction via exaggerated reflux, immune traction analysis is not identified on the skin and was not followed up. It may determine solutions of something to be variantly, maybe because of conservation frequent modeling, resulting in the enlarged immune bacterial level or increased cycle, geographic reflux. Investigations influence presenting with the first suggestion of the sun and years structural normalization happening. Renal defects on both is not a good sign of infection in its cause, extent to which a trial should have for investigations resolution. It does not only require the investigation radiation will not present, also because the lack of evidence ways to show the investigation improves outcomes unless urine extraction is demonstrated. My VR usually falls on Thursday and updated to stop my VR with my vision is very damaged. We have stable in a way to pay when extensive investigation torture and media potentially have recurrent repairs if you associate with critical features of suicidal septicemia, poor human flow, abdominal bladder mass, leaves kitchen and quickly to respond to suitable antibiotic system to 48 hours and extraction rate if you normal items. If there's extraction support is not normal, bladder the more and she really should be non-fluffy. Functions found in as the micro should be the for 3 months after urea and then some rare for the extraction to avoid missing a newly developed style because of false processing from the transfer information. The need for any investigation is only very simple told media systems also controversial. Management all influence and 3 months of this is especially the or